what you're looking at here is the top of your heart where deoxygenated blood is coming back into the heart. This would be your superior vena cava, where all of your blood for the rest of your body will come into the top of your heart, which is considered the right atrium. At this point, blood flow from the rest of your body will come in here deoxygenated. It will come into the right atrium, where you have a valve separating your right atrium and your right ventricle. The right atrium, in addition to being part of the heart, which is the plumbing part of the heart, which is the pumping and squeezing, also is where the electrical activity of the heart begins, somewhere up in the top right atrial wall there. It'll come through somewhere over here to your AV area of your heart, which is on the septal wall of the heart, and then from that point on, the electrical activity will continue through the heart. But in order for the blood to get through, we have to come through this supply right here, which is the tricuspid valve. Every time the heart beats, it squeezes. This valve will open and close, allowing the flow of the blood flow to come through the heart to this side. Get out of the right atrium, you've now stepped into the right ventricle. This will be the last stop of the right side of your heart. We've started in the right atrium, we're now in the right ventricle. Go to the lungs of the heart, where it will become oxygenated again. If you've ever heard of something called a pacemaker, this is where one of the leads of the heart where the pacemaker would sit. Somewhere over here on this septal wall, or down there in the apex of the right ventricle. That's where if you had to have an some type of electrical issue that you needed a pacemaker to help stimulate the heart again and get the heart to beat appropriately, those leads would sit somewhere over here in the right ventricle. You could potentially have one in the right atrium, but this is where most of the generator, the pulse generator of the heart, where it will begin the electrical activity. So once again, we've come through, we started the top right atrium, deoxygenated blood came through the tricuspid valve, we're now in the right ventricle, we're going to shoot through the pulmonary valve to the lungs, we will go to both the right lung and the left lung, blood will become oxygenated once again, and then it will end up on the left side of the heart over there. In reality, this septal wall here would come all the way down here. We would not have this area open, but for these purposes, of course, we're showing you that you can. Here we have a display of a ventricular septal defect, where in reality, if you had the hole, it would pass through right there and blood could come to the other side of the heart. This would not be anatomically good because you would have deoxygenated blood coming to the oxygenated side of the heart, which would then go to the rest of your body. This would not be good. But for our purposes, this is our mega heart image. So now here we are on the left side of the heart. Blood has gone through the pulmonary valve into the pulmonary arteries, both the left side and the right side of the pulmonary arteries. We'll then drop the blood off into the left atrium of the heart. The left atrium will pump through the mitral valve here, opening and closing into this left ventricular side of the heart, where ultimately the last stop in the heart, the blood will shoot here through the aortic valve, through the aorta into the rest of the body as oxygenated blood.